Good evening. My name is Melinda Rearden. I am videoing my complete physical exam for Nursing 301, Section 304. Let's get started. My patient's ready. So, knock on the door, walk in, wash my hands, introduce myself. I'm Melinda. I'm going to be your nurse today and do your exam. What is your full name and date of birth?
Corey Green, July 21st, 1984.
Perfect. And what do you prefer to be called?
Corey.
Corey. Okay. Nice to meet you, Corey. So we're going to do a few questions to get this started, and then we'll start the exam. First question, do you know time and date for today?
Date is November 26, 2018, and time should be around 5:55, 6 o'clock.
Perfect. And do you know where you're at right now?
Yelm, Washington.
Perfect. Do you remember what high school you went to?
Mount Tahoma.
Okay. And do you remember what you ate for breakfast today?
I had yogurt.
That's a good breakfast. Okay. So I would do your vitals currently, but for the time for the video, your normals are about 124/72. Your pulse will be 68, 16 for your aspirations, 97.4 for your temp. Not in currently pain. He does have some soreness on his left from a recent tooth pain or pull, but not currently any pain, so 0 out of 10. So I'm just going to do a quick observation and then we'll start.
Okay.
So I see a 34-year-old man, appears his age, sits here, no obvious distress, no rapid breathing, no accessory muscles. Your chest is symmetric, your shoulder is symmetric, hair is distributed symmetric. I don't see any lesions, open areas. Skin tone is equal in tone bilaterally. You do have tattoos on inside of both of your arms. I don't see any skin tags, lesions, anything like that would be of concern. The temperature is warm and dry to the touch. Skin trigger is good, no tinting, so no dehydration. I don't see any clubbing, no sponginess of the nails. Bilateral capillary refills, less than 1 second on bilaterally. Perfect, thank you very much.
Thank you.
So next thing I'm going to do is I'm just going to look at your hair. It looks clean, appropriate. It's dry, not greasy. I don't see any infestations. I'm just going to palpate. Any pain when I do that?
No.
Perfect. No masses or lesions felt. I'm going to have you just close your eyes and open them for me. Perfect. And then puff out your cheeks. Perfect. So that was just testing the cranial 7, which is your facial nerve. We're also going to do is I'm going to come and feel your temporal arteries, which are bilateral +2. Good. Then we come down. I am going to be gentle on your mouth since you had a tooth pulled to your TMJ or temporal mandible joint. I'm going to have you clench your teeth, open your mouth, and then move your jaw. Perfect. Okay, so that is your 5th cranial nerve, which trigeminal. Perfect. Okay, and up here, if you have any pain when I press on your frontal or your maxillary sinuses?
No.
Okay, thank you. So next we're going to move to your eyes. I'm just going to observe right now. Your hair is distributed symmetrically on your eyebrows, your eyelashes. I don't see any discharge, redness from here. I'm just going to pull your eyelids down. Sclera is white with little vessels noted, which is normal. Your irises are the same color, same size, and your pupils are also the same size bilaterally. Conjunctivi is white clear in color, pink clear in color. I don't see any drainage or any type of discharge from them, no swelling. I don't see any edema in your eyes. If I had an ophthalmoscope, which I don't, I would take a look at your eyes. I'd be looking in your eyes at your macula. I would make sure it's the right color, the right shape, right size, bilaterally make sure they're the same spot. I'd also be looking at the optic nerve. Make sure those are intact. They're not larger, smaller than the other. Also look at vessels. Make sure you don't have any increased pressure in your eye, any blockages, any abnormal masses, anything like that. So if I had the ophthalmoscope, I'd be look like that. So next, we're going to do some vision checks. These are going to check your cranial nerve 2, which is your optic nerve, which is sensory. It's also going to check cranial 3, 4, and 6. So it's going to be your ocular motor, your trochlear, and your abductans, which check your extraocular muscles. So for this, our first eye test, I'm going to give you this. I'm going to have you cover your right eye. I'm going to cover my left. I'm also going to bring my hand from 3 different points on the right and then one from this side. While you're looking straight at me, tell me when you see it perfectly.
Okay.
Okay.
See it. See it. See it. See it.
Okay. Now switch sides. Do the same thing. Okay.
See it. See it. See it. See it.
Perfect. Thank you. I'll take that. So the next one is I'm going to gently flash light into your eyes. Just going to make sure that they are, I know, from both sides. It's just going to make sure that the reaction or the reflection is equal on both sides.
Okay.
I'll try not to blind you. Just look straight at me. Thank you. So next, I'm going to have you look straight ahead at this.
Okay.
Without moving your head, I'm going to have you follow it with your eyes.
Okay.
Perfect. Okay. Now I'm also going to have you follow it straight. Perfect. Thank you. So no nystagmus, no involuntary movements noted. Reaction pupils were equal around the reactive to light. Just a little bit there, right? Okay, perfect. So, and then going back to the TMJ joint, there was no pain. I didn't feel any open areas, and no creaking or cracking felt with that. So from here, we're going to move on to your ears. So we're going to do just kind of a quick visual. They're symmetric on both sides. From what I can tell, I don't see any obvious deformities, any open areas. First thing I'm going to do is I'm going to press in on the tragus. Any pain?
No.
Perfect. And then the pinny. Any pain when I mess with these?
No.
Perfect. Noted that he does have a piercing on his left tragus, but it's been there for a while. I'm guessing it's not new and there's no drainage or redness or anything like that. Okay, perfect. So next I'm going to look inside your ear at your tympanic membrane. I'm going to have you slightly tilt your head that way. Okay, perfect. So tympanic membrane, gray in color, slightly indented, but no fluid behind it. A little bit of wax, but not much. No redness. Perfect. Okay. So same thing. A little bit of wax noted. No lesions, no open areas. Both of your tympanic membranes are gray in color, grayish pearly. No buildup of fluid behind it. No open areas, no drainage. So that's good. So next thing we're going to do is a few hearing tests. These hearing tests also test for cranial nerves 9, 10, and 12. So he's going to test for the hold on, cranial 9, 10, and 12, which is going to be the, and of course, my drawing blank. I will come back to that, but we're still going to do the hearing test, and then I will remember. Okay. So the first hearing test we're going to do is called the Weber.
Okay.
This little fancy thing, I'm going to make it vibrate. I'm going to stick it on top of your head here. This is for conduction, so you should feel it bilaterally on both sides.
Okay.
If you don't, let me know. Okay.
Okay. Yes.
Perfect. Thank you. So the next one we're going to do is called the Renee test. I'm going to do the same thing, except for I'm going to put it back here on the mastoid process, and the bone back here.
Okay.
This is bone and air conduction is what we're testing. So as soon as you stop feeling that, I'm going to put it next to your ear, and then you should be able to hear it better.
Okay.
When you stop that, then let me know. Okay.
Stop.
This should be longer. The air conduction should be longer than the bone conduction. So, okay. Next thing we'll do on this side. Oh, sorry.
Stop.
So here.
Still going.
Okay. Perfect. So bone conduction should be less than air conduction. Okay. So the cranial nerves that we were doing was the ocular motor, the trochlear, and then also the I'll come back to the other one. Ocular and ocular motor, trochlear, and there was one other one, but I will remember it in just a second. Okay. So we are going to move on. We did your eyes, we did your ears. We're going to move to your nose now. It's midline in your face. I don't see any obvious deformities. I'm just going to go right here. Any pain?
Nope.
Okay. Your nares are symmetric on both sides. I don't see any drainage. I'm going to check for patency. When I do this, I'm just going to close one nostril and have you breathe in.
Okay.
Or sniff. Perfect. Perfect. If we are checking for the olfactory, which is cranial nerve 1, I would give you something to smell with your eyes closed. We're not doing that today, but do you have any issues with senses?
Nope, they're good.
Perfect. As long as you can smell, we're good. So the next thing I'm going to do, let me switch out my little thing. So I'm going to take a look at your... Okay, let me get one more. Actually, before we do this, I'm going to go back. I need to check the cranial 8 nerve, which is your acoustic also. So I'm going to come back here and do, you're good, you sit right there. So I'm going to whisper a 2-syllable word. When you hear it, repeat it for me, and I'll go on the other side and do it also.
Apple. $99.
Okay. So whisper test you passed. Okay. Now we're going to look at your nose. Just going to gently look. Without poking in. Perfect. I don't see any deviated septum. Mucous membranes are intact, no drainage. Pinkish red in color. They look moist. The turbines also are intact and same color as the rest of your mucous membrane. So now we're going to move to your lips, your mouth. Just going to look generally right now. They look moist. They don't look like they're cracked. No obvious lesions. No cold sores. Nothing that I can see. Perfect. You have mustache ears, stuff like that, which is symmetrical in distribution. Perfect. Yes. Okay. So I'm going to take my light and I'm just going to look inside your mouth for right now. Okay. See, your teeth are intact. You did have 2 of them recently removed. The one on the right is definitely healed, no inflammation. It's pink like the normal. The one on the left still has a scab, inflammation a little bit, but you did have an infection, correct?
Yes.
Okay, so you're on antibiotics for that?
Yes, amoxicillin.
Okay, and then pain meds, ibuprofen, anything like that?
800 milligrams of Motrin as needed, if needed.
Okay, perfect. Let me see one more thing. Okay, so tonsils, barely noticeable, but they're there, so +1. Your uvea is midline. So next thing I'm going to do is test a few of the 8, 9, and 9, 10, and 12 cranial nerves. So it's going to be your hypoglossal, your glossal pharyngeal, your vagus, and your hypoglossal cranial nerves. So first thing I have you do is open your mouth and say ah.
Ah.
Perfect. Next, I'm going to do in your gag reflex. Sorry, I know. That's intact though. Okay, yeah, and then I'll have you stick your tongue out. I get to torture my husband. This is kind of fun. Perfect. Okay. Okay, so that was good. We'll stick this over here. So next, I'm going to physically check for lumps and bumps and anything else in your mouth. I promise I'll be gentle. Okay, so I'm just going to have you open your mouth. I'm going to feel your cheek first. Not feel anything. And now let me see your tongue. Perfect. Okay, remove your tongue. Perfect. So no white spots, no lumps, no lesions. Do you chew or smoke?
No, never.
Perfect. Okay, and obviously you go to the dentist because you haven't just been seen recently. Besides any recent infections in your mouth, besides the ones that you were just treated for?
No.
And do you still have your wisdom teeth?
Yes, I do.
Okay, perfect. So we're going to move down. We're going to move to your neck next. So I'm just going to look from here. It's midline, where it's symmetric on both sides. I don't see any lesions. I don't see any swelling, edema, abnormalities. First thing we do though is have you check. We're going to check your accessory muscle, which is your cranial nerve, which is number 11. I'm going to have you push against my hands. Perfect. Okay. And then I'm going to have you push against. Thank you. And push here. Perfect. Okay. So the thing is I'm going to check your lymph nodes. So I'm just going to palpate gently. So this is your preauricle. And there's the jugular gastric, submandibular, submental, postauricle, occipital. You okay?
Mm-hmm.
Okay. And then down here is going to be your superior cervical. I'm going to have you tilt your head just a little bit, or tilt your head towards me, sorry. And down here is going to be your deep cervical chain. Okay. Now, when I do your supraclavicle ones, I'm going to have you look to the right. It may tickle a little bit. So I'll have you look to the right first. Perfect. Look to your left. Perfect. Okay. So no lymph nodes felt. Everything was good. So any pain when I did that?
No.
Perfect. Okay. So next thing I'm going to do is palpate your trachea to make sure it feels midline. Just place. Perfect. I'm going to do carotid artery. Perfect. +2. +2 bilaterally. I'm also going to listen to the carotid just to make sure you don't have any bruise. Use the bell. No. Perfect. No. Okay. So next thing I have to do is to check your thyroid. So for this, though, I will need to come from behind you. So I'm going to actually, it's not the best situation. So I'm going to actually have you, turn this way. Well, let's see if you get comfortable because I'm going to do your whole back after this. So I'll just scoot over a little bit on the bed so you don't fall off. Okay. So first thing I'll do, down here, palpate your thyroid. I'm going to have you swallow. Perfect. Okay. So your thyroid's moved up and down. I don't feel any abnormalities, any lesions, anything like that. Okay. So while I'm back here, I'm going to do your posterior thorax and your back. So have you just sit here comfortably as you can for a minute. Perfect. So symmetrically, your back, your shoulders are symmetric. One's not higher than the other. Your scapulas are also symmetric. I do see you have a tattoo in your middle. I don't see any open lesions, obvious lesions, or abnormality masses. Next thing we do is just palpate. So if anything this hurts, just let me know. Is that any of that hurt?
No.
Perfect. Okay. So the next thing I'm going to do also is just to palpate your spine. Any of this hurts?
No.
Perfect. I do see we do have a 6 centimeter scar. Have you had back surgery before?
Yeah, about 2 years ago I had my L4, L5, and S1 fixed. They ruptured.
They ruptured? Okay, perfect. Any pain from that still?
Every day.
Every day. Okay. So the next thing I'm going to do is I'm going to check for a thing called tactile firmitus. It's just vibration in your chest. So when I put my hand on you, I just want you to say 99, okay?
99, 99, 99, 99, 99, 99, 99.
Perfect, thank you. So the next thing I'm also going to do is called percussion, which you're just feeling me tapping. It's just checking for resonance over the lung field. So. So bilateral resonance over lung fields, and then higher or lower than normal. Any pain when I did that?
No.
Perfect. Okay. So the next thing I'm going to do is I'm actually just going to listen to your lung sounds, make sure there's nothing abnormal. When I do, when you feel my stethoscope on there, will you just please take a deep breath, a normal breath in and out.
Okay.
Make sure to use the diaphragm on this. Perfect. Okay. So no adventitious sounds. I don't hear anything crackly, crepitus, anything like that. As a side note, you would hear bronchial vesicles here, and then more of the vesicular sounds on the outside. But closer to the column would be more of the bronchial and the trachea. Perfect. So next I'll have you do is just turn back to the way you face me. So I'm just going to kind of do the same thing at the chest. From here, then we'll move to the abdomen. I'll have you lay down. But for right now, I'll just have you stand.
Okay.
So I'm just going to look at your chest. Same thing. Your shoulders are bilaterally symmetric on both sides. I see your clavicles. They don't look, never had a broken clavicle. Okay. Your hairline is distributed normally or symmetric on both sides. I don't see any lesions, moles, anything like that. I'm just going to go like this. I'm going to have you breathe in and out normally. Perfect. So symmetric expansion for your chest, so that's a good thing. And then I'm just going to palpate and see if there's any pain. Let me know, okay? No pain? Perfect. Okay. So the next thing I'm kind of going to do this exact way to the back. I'm going to do the tactile affirmatives. So when I put my hands on you, just say 99.
Okay. 99, 99, 99, 99, 99, 99.
Perfect. Okay. And then I'm just going to percuss the same thing. So you just sit back and be comfortable as you can be. Perfect. Okay. So same thing, equal resonance across. And next I'm just going to listen to your lung sounds.
Okay.
So same thing. When I do this, just breathe in and out like normal. Perfect. Thank you. Okay. So no adventitious lung sounds either way. Same thing, you'll feel more of the bronchial vesical sounds here, more of the vesicular ones on the outside. Okay. So next I'm going to do your heart. So I'm going to have you lay down. Let me get you a little pillow. Not the best, but are you comfortable?
Very.
Okay. So next thing I'm going to do is just kind of feel your chest. I'm going to look at the pericardial area, just to feel if there's any vibrations, any abnormalities. This is just the part over your heart. So you just relax. Okay. And I can feel the apical. Perfect. I'm also going to look for any pulsations or any thrills, anything like that. Checking for all that. See it? Okay, perfect. So, I do feel your apical pulse here. I didn't feel any thrills or any type of crepitus, anything that would be abnormal. So next thing I'm going to do is going to listen to the areas of the heart. First, I'm going to use the bell, and then I'll use the diaphragm. So this first one is going to be the aortic, which we find the sternal notch, and the angle of Lewis right here, and then the second intercostal space. So the aortic valve is going to be on the second intercostal right side of the sternal border. Which is also the base. Okay. Then I'll go over here onto the left second intercostal space, which is the pulmonary valve. And we'll come down to the third intercostal space, which is the Ebb's point, which is the midline or midpoint of the heart. And we'll come down to the fourth intercostal lower sternal border, which is going to be your tricuspid valve. And we'll listen to that. And then we're going to come down to the fifth intercostal mid-clavicular line. This is your apex, but it's also where we would get the apical pulse from. Perfect. So next I'm going to go back up, and I'm going to use the bell versus the diaphragm. So same thing. I'm going to listen to the apical for the mitral valve. Then we'll go back up to the fourth intercostal and listen to the tricuspid. And then the third, where the Ebbs point. Okay. And the pulmonary. And then the aortic. So if I was doing the appropriate timing, we would do a full minute at your apical pulse to get your actual apical pulse. But for the video. Also, just a side note that you hear S1 in the apex louder and S2 louder in the base. But I did not hear any S3s or S4s, so no abnormal or extra heart sounds. So everything's good. You ever had any issues with your heart?
No.
Perfect. That's a good thing. Let's keep it that way. Okay. So next thing we're going to do is we're going to move to your abdomen.
Okay.
So I'm just going to have you as relaxed as you're able. I'm actually going to have you bend your knees, just like that. So first thing I'm going to do is just same thing. I'm going to observe, then I'm going to listen, and then we'll go from there, okay? At any point you feel pain, discomfort, let me know. Okay. So I'm going to observe your abdominal area is symmetric. Hairline is distributed symmetric bilaterally. I don't see any swelling or edema more on one side. I don't see any lesions, open areas, scars. I'm going to look and see if I have any pulsations. I do see one slightly right here, but that would be your aortic valve or aortic aorta. So that would be normal. Perfect. Okay. So next thing I'm going to do, I'm just going to listen to your bell tones. I would normally listen for a full minute on both sides, but due to time constraints, it'll be a little bit less. Okay. So I'm going to start in your right lower quadrant. Perfect. Right upper quadrant. Okay. Left upper. Perfect. Okay. And your left lower. Perfect. Okay. So normal bell tones, maybe a little hyperactive a little bit, but with the antibiotics he's on, it can cause GI upset and side effects. So that could be why it's a little bit more hyper in some areas than others. The other thing I'm going to listen to is the arteries that go down. So I'm going to listen to those real quick. So first one I'm going to listen to is the aorta. Show this one. Perfect. And then I'm going to do the renal, right renal, and the left renal, and then the left iliac, right iliac, right femoral, left femoral. Perfect. So you really didn't hear him, but that's pretty normal. But you can definitely see the aorta pulsation. So next I'm going to start by palpating. Actually, I'm going to percuss and then palpate. So same thing, you're just going to feel me tap. I'm just going to listen to the sounds. So have you move your hands just a minute. Thank you. Okay. Okay, so same the resonance. bilateral across. I don't hear anything abnormal. So now I'm going to palpate gentle, very light, and then I'll get deeper. So if anything, let me know if I have pain. So I'm going to do it a little bit deeper, so just let me know. Okay, so I didn't feel any masses, I didn't feel any abnormal lumps or anything like that. So next thing I'm going to do is palpate for your kidneys, your spleen, and then, or your liver, your kidneys, and then your spleen. Okay. Perfect. Over here. Okay. So they were not palpable, which is normal, but that's a good thing because if we can palpate your spleen, that usually means something's wrong. So any pain or discomfort while I was doing that?
None.
Perfect. Okay. So after that, we're going to move to your extremities. So I'm going to actually just have you lay here. I will do your upper extremities, and then we'll move down, and then we'll have you sit up in a minute. Okay?
Sounds good.
So first I'm going to do your upper extremities. I'm just going to look at your arms. I know. Okay. So they look comfortable, bilateral. I don't see any. The muscles are symmetric on both sides. Your shoulders are symmetric. I don't see any obvious deformities. Your skin tone is symmetric on both sides and even. I don't see any moles or any type of lesions. Have you had your skin and stuff checked before by like a dermatologist or anything?
Never.
Okay. That might be something down the road. But you do have tattoos on both sides, both inner arms. Okay. And I'll just have you. Perfect. Okay. So I'm just going to check your femoral artery or your pulse real quick. Perfect. You can do it on this side too. Good. So bilaterally +2, so normal. I'm going to do your radial pulse on both sides. Very good. And here. Okay, so equal also. Bounding +2, so normal. To your hands. Same thing. Capillary refill, less than 1 second. No clubbing, no sponginess. Perfect. Okay. So I'm going to actually have you do some range of motions. I'll have you bring your arms up and down. So flex and extend. Perfect. Okay. And then I'll have you open your hands and close them. No pain on any of that.
No.
I'm just going to feel your joints really quick. Any pain when I do this?
No.
Okay. I don't feel any masses, any deformities, any hard spots or anything like that that would not be there. Let me see your joints. Any pain here?
No.
Perfect. I don't feel any nodules. I'm going to have you shake my hand though. I'm going to check right here for the F. Perfect. Okay, next one. Okay. Perfect. Okay, you stop. Okay, so I was just checking for the epitrochlear nodules, which are not, I couldn't feel any, so they're not noticeable, which is more lymph nodes for you. I also didn't feel any type of masses, lumps, or anything in the joints. No pain when he moved them, no pain upon palpation. Any pain here?
No.
Okay, perfect. And then when I press on your fingers, any pain here?
No.
Okay. So I don't feel any masses, any nodules that would be with like rheumatoid arthritis, anything like that. No pain upon palpation on any of the joints in the upper extremities. Cool. And no pain when he moved them. Perfect. Okay. So next I'm going to move down to your inguinal, so your femoral arteries. These are your brachial, and then I'm going to do femoral arteries next. So it could be right here. I know. Perfect. It might be a little ticklish. Also, okay, so femoral arteries intact bilaterally +2. Also would look for any type of nodes or anything, the inguinal nodes, which I didn't feel anything. Then we're just going to pull these up a little bit, but still keep you covered. Okay, there we go. So I'm just going to look at your legs bilaterally. The hair distribution is bilateral on both sides. I don't see any bald spots, anything missing. The joints, calf muscles, everything looks symmetrical. Perfect. So I'm going to start here and just start palpating. And just tell me if there's any pain. Okay. Any pain here?
Nope.
Okay. And come down here. Joints. Any pain in the joints here?
Nope.
The feet. Perfect. Okay. And same thing here. So no masses. No pain upon palpation of the joints. I don't see any edema, any swelling, no redness. I don't see any skin lesions. I don't feel any masses in either of his legs. All the joints are appropriate size, no pain. I have no edema on his bilateral feet. I'm going to check, have you been this one a little bit? I'm going to check for your popliteal. Okay, and then this one. Perfect. Okay, so bilateral popliteal artery or pulses are intact +2 equally. Next, I'm going to check for the bilateral post-tibial arteries and pulses here. Good. They're equal. They're on both sides. +2. And then I'm going to check for the dorsal pedius pulses. Perfect. Okay. So they are also bilateral. So now I'm going to have you sit up, please. Thank you. So you didn't look like it was hard for you to sit up at all, so that's a good thing. It means your muscles are working well. We've done joints and stuff like that. So next thing I'm going to do, we're just going to do some balance, some sensation testing really quick. So first of all, I'm going to do some range of motion. I'm going to have you look with your head left and right. Okay, up and down. Perfect. Okay, now I'm going to have you push against my hand while I push against yours. Perfect. Okay, thank you. Okay, so next thing I'm going to do is I'm going to have you take your arms out to your side, which is abduction, and then bring it back in, which is adduction. And then I'm going to have you, okay, which is flexion and extension. Perfect. So now we're going to test the muscle or strength of your muscles in your elbow. So I'm going to have you do the same thing, but I'm going to have you against my resistance. Perfect. Okay, let me see this one. Same thing. Perfect. Thank you. Any pain or anything like that?
No.
Perfect. Okay. So next thing I'm going to also have you do, so we checked your cervical, we did your upper or your lower. So have you lay back down one more time. Sorry.
You're okay.
I just realized this would be easier with you laying down than sitting up. Okay. So one thing I'm going to have you do is with your right leg, I'm going to have you bring it up. Okay. And bring it down. And then I'm going to have you bring your knee in. So flexion, extension. Okay, so next thing I'm going to do is I'm just going to gently push your foot in. If you feel any pain, tell me. Perfect. Okay, so that's a Holman sign,
Okay.
which checks for possible DVTs. It's not 100%, but without pain, that's a negative Holman sign. So same thing. I'm going to bring your leg up. So flexion, extension. Bring your knee. Flexion, extension. And I'm going to do the same thing. I'm going to bring the Holman sign up. No pain?
No.
Okay, cool. So negative Holman sign bilaterally on both legs. And no indication of DVTs, no redness, nothing like that. Now you can sit up. Okay, so last thing we're going to do is just some sensations, some balance and stuff like that. So first thing I'm going to have you do is I'm going to run soft cotton in certain places and just tell me when you feel it.
Okay.
I'll have you close your eyes too.
Feel it. 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 Feel it.
Perfect. Okay. So the other thing I'm going to do is more of a sharp and dull pain.
Okay.
Without you seeing it. So I want you to tell me what you feel.
Sharp. Sharp. Dull. Dull.
Okay. So the other thing I'm going to have you do is I'm going to press in 2 spots at the same time.
Okay.
And let me know when you feel both of them.
Both.
Okay. Perfect. Okay. So then I'm also going to do some vibrations. So just let me know when you feel this, okay?
Okay. Feel it. Feel it.
Okay. So next thing I'm going to do is have you stand up. Walk to the door, please. So first thing I'm going to have you do is walk towards me. Just barefooted walk towards me. Perfect. Okay, stop. I'll have you turn around. Now we're going to walk to the door, but you're going to walk putting your heel to your toes. Perfect. Okay, thank you. You turn around. Next thing I'm going to do is have you close your eyes and stand on one foot and then switch. Perfect. Okay, now open your eyes and I'm going to have you hop on one foot and then rotate to the other. Perfect. Okay, and then next thing I'm going to do is also I'm going to have you put your arms out and touch your nose. Okay, and then I'm going to have you take your fingers and your thumbs and touch each finger and just rapidly go like that. Perfect. Thank you. You may have a seat. Okay. That concludes all of our physical exam. Do you have any questions?
Not at all.
Awesome. I will definitely grab the doctor next and you'll be good. Thank you for your time.
Thank you, nurse.
That concludes it.